Hello, and thank you for listening to my presentation. My name is Gabby Thayer, and today I will be presenting on POTS, also known as Postural Orthostatic Tachycardia Syndrome. First, we're going to do a little bit overview and background of POTS. POTS was first described in the 1860s as Civil War Syndrome or soldier's heart, and it wasn't until 1993 that POTS was termed by the Mayo Clinic. POTS stands for Postural Orthostatic Tachycardia Syndrome. So postural refers to the position of the body, orthostatic is the standing upright, and tachycardia is the rapid heart rate, and syndrome is the group of symptoms involved. POTS is a disorder of the autonomic nervous system. And in these patients, when they change into supine position, so going from seated or laying down to an upright position, this leads to a rapid heart rate and decreased blood flow to the brain. These could be caused by several different things, including elevated levels of hormones such as norepinephrine, different genetic factors. It could be secondary to another autoimmune response, such as a virus, immunization, or infection, or it could be caused by a neuropathy. Before I go into too much detail about POTS, I really want to take a brief overview of what's happening in the body. So in a normal body, when you stand up or you sit up, your body adapts. The hormones are released, and these help tighten blood vessels and allow more blood flow to your heart and brain, really evening out the circulation so that you don't get this pooling. But in POTS patients, these blood vessels insufficiently tighten, which causes that blood pooling that we see in them, lightheadedness as there's less blood flow to the brain, and this can cause fatigue as well. There are 4 different types of POTS that I want to talk with you about today. The first 2 are secondary POTS and neuropathic POTS. And these 2 are really connected because of this neuropathy that's characteristic of both. So secondary POTS is caused by a different condition though. So like the immunization or the viruses that we discussed before. While neuropathic POTS is the small fiber neuropathy, and this is the most common type. So what's happening here is there is a denervation to kidneys and the vessels, which lead to decreased vasoconstriction. And then there is an increase in nervation to the heart, leading to an increase in heart rate. And you can see this in the pictures below from a normal patient to one with neuropathic POTS. The 2 other types of POTS that I want to talk about are hypovolemic and hyperandronergic POTS. In hypovolemic POTS, there's a deficit in blood volume and decreased oxygenation. What's really being affected here is the renin-angiotensin-aldosterone system, which is connected to the kidney. Specifically, it is part of the angiotensin II, which is important for promoting sodium and water retention. But in these patients, they have a low amount of the angiotensin II. These low levels are primarily unexplained, but could be caused by denervation in the kidney. In hyperandronergic POTS, there is an elevated level of norepinephrine, and this causes resting sympathetic nervous system activity. So these activations can lead to an increase in blood pressure, palpitations, tachycardia, and even tremors. A rare form of this is the function mutation in the gene for norepinephrine transporter, the NET gene, which leads to increased synaptic norepinephrine. Some of the symptoms involved in POTS patients include blood pooling, tachycardia, brain fog, exercise intolerance, and even gastrointestinal symptoms. Here are a few pictures from my sister's Instagram. She has POTS, so these are showing a little bit of her life with it. First one, you can see the blood pooling. She is sitting down, and because of the decrease in vasoconstriction, the blood has pooled to her feet. And then the next one, you can see that her heart rate is 150 just from going from a seated to a standing position, showing that tachycardia. There are a wide variety of effects to individuals who have POTS. Over 50% experience disruption in their education. Approximately 25% file for disability, but there also are some who experience full recovery. Approximately 50% of adolescents with POTS had fully recovered after an average of 5 years of initial therapy. So while this is very detrimental to some people and really shakes their way of life, there are some that are able to recover from this and not have those long-lasting effects of disruption to their education or needing to file for disability. There are several different diagnostic tests that can be performed to diagnose POTS. One of these includes the tilt table test, which a patient will lay down on a table and slowly be moved to an upright position. And during this process, they will monitor their heart rate as well as a few other things. And they will be looking for the heart rate increase of more than 30 beats per minute from supine to standing, and making sure that the symptoms get worse with standing and better with laying down. There also is an exercise stress test, which really looks at the orthostatic intolerance seen in this disorder. There also are some autonomic tests because this is an autonomic disorder. So looking at the Valsalva maneuver or the QSART, and these are looking at different autonomic nerves and seeing how they have been affected and if they play a role in the disorder. There are several different treatments available for POTS patients. Some non-pharmacological include diet, physical therapy, or other programs really to help with that orthostatic intolerance, and then avoiding triggers. Some pharmacological include clonidine, beta blockers, ivabradine. Really, beta blockers are the most common because it's a medication to slow the heart rate, which addresses the tachycardia part of this disorder. There's also erythropoietin, which is most common for those who have hypovolemia POTS, as this is a hormone that stimulates that blood production. Now let's look at the effect on the population. So about 1 to 3 million Americans are affected by POTS, and 75 to 85% of this is female, and most of the onset between 15 and 25 years of age. Approximately 75% receive diagnosis 1 year or more after the onset of symptoms, with an average time to diagnose 5 years and 11 months. You can also see in this top graph that the time for onset of symptoms to POTS diagnosis is large, the average being the 5 years and 11 months, which is quite bleak, and some that are even more than 16 years to receive a diagnosis. And then you can see below that some different diagnoses that were given before POTS diagnosis. So all in your head, panic disorder, anxiety, stress from working in school. And I think this is really the danger of POTS, is that a lot of the symptoms are similar to anxiety and it's hard to distinguish. And so I think that's why we really need more research and information about this disorder so that we can better diagnose our patients. I will say that Dysautonomia International has put a lot of focus and emphasis on researching and funding and bringing awareness to POTS in the last few years, and I think this is really hopeful for the outcome of POTS patients. Here are some references that I used in this presentation. Thank you for listening. I hope that you learned something about POTS.